In this video we will talk about vitamin D3, which is also known as cholecalciferol. It is a fat-soluble vitamin that plays an important role in various aspects of human health. Also, vitamin D3 is a nutrient that plays a significant role in maintaining overall health, such as immune support, cardiovascular health. It is particularly involved in the absorption of calcium and the health of bones and teeth. First, we will discuss some health benefits of vitamin D3, bone health. Vitamin D3 is vital for the absorption of calcium and phosphorus in the gut, which is essential for maintaining strong and healthy bones. It helps in preventing conditions like osteoporosis and osteomalacia. Immune system support. Vitamin D3 plays a role in the immune system's function. It can help the body defend against infections. Vitamin D may make severe flu and COVID-19 infections less likely. A recent review found that low vitamin D levels contribute to acute respiratory symptoms. Cardiovascular health. Adequate levels of vitamin D3 may be associated with a lower risk of cardiovascular diseases. It can help regulate blood pressure, reduce inflammation, and improve overall heart health, decreasing the chance of heart disease. Low vitamin D levels have been linked to increased risk of heart diseases, such as hypertension, heart failure, and stroke. Cancer prevention. Some studies suggest that vitamin D3 may reduce the risk of certain types of cancer, including breast, prostate, and colon cancer. It is believed to have anti-cancer properties. Mood and mental health. Vitamin D3 is linked to the production of serotonin, a neurotransmitter that contributes to feelings of well-being and happiness. Deficiencies in vitamin D3 have been associated with an increased risk of mood disorders, including depression. Skin health. Vitamin D3 is important for skin health and can help in the treatment of skin conditions like psoriasis. It may also aid in wound healing and skin cell regeneration. Weight management. Some research suggests that adequate vitamin D levels may aid in weight loss and the prevention of obesity by influencing the body's metabolism and appetite regulation. Muscle strength. Vitamin D3 is essential for maintaining muscle strength and function, which is especially important for the elderly in preventing falls and fractures. Diabetes management. Adequate levels of vitamin D3 may help improve insulin sensitivity and regulate blood sugar levels, which can be beneficial for individuals with diabetes. Autoimmune diseases. Vitamin D3 has been associated with a reduced risk of autoimmune diseases, such as multiple sclerosis, rheumatoid arthritis, and Crohn's disease. It may help modulate the immune response in these conditions. While the body can produce vitamin D3 when the skin is exposed to sunlight, many people rely on dietary sources to meet their daily requirements. Here are some common food sources of vitamin D3. Fatty fish. Fatty fish such as salmon, mackerel, trout, and sardines are excellent sources of vitamin D3. A 3.5-ounce serving of cooked salmon can provide over 570 international units of vitamin D3, which is well above the daily recommended intake. Cod liver oil. Cod liver oil is one of the most concentrated sources of vitamin D3. Just 1 teaspoon of cod liver oil can supply more than 1300 IU of vitamin D3. However, it's essential to use this source in moderation due to its high vitamin A content. Egg yolks. Egg yolks contain small amounts of vitamin D3, with approximately 40 to 50 IU per large egg. Including eggs in your diet can contribute to your daily vitamin D intake. Dairy products. Some dairy products like fortified milk, yogurt, and cheese contain added vitamin D3. The exact amount can vary, but it typically ranges from 100 to 130 IU per 8-ounce glass of fortified milk. Fortified foods. Many foods are fortified with vitamin D3 to help individuals meet their daily requirements. These may include breakfast cereals, orange juice, and plant-based milk alternatives like soy milk or almond milk. The amount of added vitamin D varies by brand and product. Beef liver. Beef liver is a good source of various nutrients, including vitamin D3. A 3.5-ounce serving of cooked beef liver can provide about 49 IU of vitamin D3. It's important to note that the amount of vitamin D3 in foods can vary depending on factors such as the animal's diet, sun exposure, and food processing methods. Additionally, vitamin D3 is also available in supplement form for those who have difficulty obtaining sufficient amounts through their diet or sun exposure. It's also important to note that while vitamin D3 offers numerous health benefits, excessive supplementation can be harmful. It's best to obtain vitamin D from a combination of sunlight exposure, diet, and supplements under the guidance of a healthcare professional. Recommended intake. The recommended daily intake of vitamin D can vary depending on factors such as age, sex, and individual needs. The reference dietary intake for vitamin D is often measured in international units. It's essential to consult with a healthcare provider to determine the appropriate dosage for your specific circumstances. It's important to adhere to recommended intake levels and consult with a healthcare professional before taking high-dose supplements. The recommended dietary allowances for vitamin D3 from the Institute of Medicine in the United States are as follows. Infants, 0 to 12 months, 400 to 1000 IU per day. Children, 1 to 18 years, 600 to 1000 IU per day. Adults, 19 to 70 years, 600 to 800 IU per day. Over 70 years, 800 to 1000 IU per day. Additionally, the tolerable upper intake level for vitamin D3 is set at 4000 IU per day for adults, meaning that exceeding this amount may increase the risk of adverse effects. Factors affecting the vitamin D deficiency. Several factors can affect your ability to get adequate vitamin D from sunlight alone. You may be less likely to absorb enough vitamin D from the sun if you live in an area with high pollution. If you use sunscreen, spend most of your time indoors, live in a big city where buildings block sunlight, if you have darker skin, then you have the high levels of melanin and the less vitamin D your skin can absorb. These factors can increase your risk of vitamin D deficiency. That's why it's important to get some of your vitamin D from non-sunlight sources. What are the symptoms of vitamin D deficiency? The symptoms of a vitamin D deficiency in adults may include tiredness, aches and pains, severe bone or muscle pain or weakness, stress fractures, especially in your legs, pelvis, and hips. A healthcare professional can diagnose a vitamin D deficiency by performing a simple blood test. If you have a deficiency, your doctor may order X-rays to check the strength of your bones. If you receive a diagnosis of vitamin D deficiency, a healthcare professional will likely recommend that you take vitamin D supplements. If you have a severe deficiency, they may instead recommend high-dose vitamin D tablets or liquids. You should also make sure to get vitamin D through sunlight and the foods you eat. I hope this will be helpful for you. Thanks for watching. If you want to watch such informative videos, please like, subscribe our channel and press the notification button.